Okay, doctor. So for NDV, we can give for on the first day,
Yes,
right?
that's common. IB and ND you can give on first day. For IBD, they have, like I said in the previous class, there's a technology for we call it antigen immune complex, where they put the antigen with antibody together, and the antibody will have a half-life, so will degenerate over time and then releasing the antigen slowly when the maternal antibody wins. Okay. So only the IBD you have to be careful. The rest is okay. Any other question? Okay, sorry for the lecture notes of Andy the other day also I haven't finished with the filing apa tu? All the notes yet. Even though it's AI today, I'm actually starting to make a new notes. Okay, because I have a lot of notes. I give a lot of presentation. So there's a lot of information I need to change and update. Let's see, share screen. Screen 1 or screen 2? Screen 1. Okay. Here, I'm compiling my notes from a few other notes that tak habis lagi. Okay, I have other notes here and other notes here and the old notes, the one that I used for previous meeting. It's just that I have find it's a bit too lengthy with all unnecessary information. I want to cut out all these things and put only the important ones. Okay. So for today's lecture, I will go here and there. Shift that. Okay, for today is on avian influenza. Can you see the screen? Hopefully you can see the screen. I'm gonna make it full screen. So I nak kena tukar-tukar screen juga ni. Okay. Let's start with the normal lecture notes. Okay, avian influenza is a highly infectious viral illness. Have you heard of all the influenza outbreak before, the Spanish flu and whatnot? Not the Spanish fly. Okay, this all these endemic what do you call it, pandemic that happened before. Okay, highly infectious viral disease epidemics reported since 1510, and we have a lot of pandemics due to influenza virus in the 20th century. Estimated more than 40 million deaths worldwide in the pandemic of 1918 to 1919. So I'm not sure whether COVID can already surpass it. Let me see. COVID death so far. COVID statistic. Death is 6 million worldwide. Okay, it's not as bad as avian influenza before, the Spanish flu, which is around 40 million. Okay, so influenza virus can be divided into type A, type B, and type C. Okay, type A usually moderate to severe illness of all age group in humans, animals, and type B is milder epidemic, primarily affect children and humans only. Type C is mild illness and sporadic cases, no epidemics reported in humans and in pigs. So for avian influenza is their type A. Okay. Influenza virus is an envelope virus containing single-stranded RNA of negative polarity, negative sense RNA, pleomorphic filamentous in morphology. So this one is more of a virology kind of things. Okay, you don't have to memorize so much, but this quite well known. It composed of 8 RNA segment. Okay, each segment encode 8 different virions, genes, or protein. Like this one. Okay, segmented single sense RNA. Okay, there's some 8 genes. Okay. There are 144 avian influenza strains in birds. Okay, basically, previously was 16 and 9. Now, based on CDC, is updated to 18 and 11. Okay, And not all avian influenza virus are zoonotic. Okay, not all avian influenza virus are zoonotic. Some are limited to animals only, affecting horse only, affecting pigs only, or affecting avian only. Okay, so that's something. This is the influenza virus host range. Okay, type A influenza virus cannot be eradicated because we have a lot of reservoir. All the wild animals, domestic animals and humans, they are reservoir to many of these influenza A virus. Okay, the horse some of the horse strain can infect the dogs, the whales, the wild animals, the mammals of the sea. Okay, and then the wild animals, the pig and human, they have different subtypes infecting different type of humans. Okay, the ecology of avian influenza virus. Influenza viruses in their natural reservoirs are in continuing evolutionary status. They keep like resortment of the genes and whatnot. They keep evolving and mutates. Okay, it's quite similar with IB as well, and IB like the coronavirus as well. Okay, they can evolve. Okay, rapid evolution occurs after they transfer to new hosts. Okay, I think you have learned this in virology as well. Wild birds, including ducks, geese, and swans, are the natural reservoir of avian influenza virus and exist in well-adapted balance of virus and birds in non-pathogenic states. And majority of avian influenza infections of poultry have been weakly pathogenic. Most of the avian influenza in poultry are mainly low pathogenic avian influenza. Okay, rarely avian influenza can mutate in poultry to highly pathogenic, become HPAI, causing severe diseases with high mortality in chickens and able to might to cause infection in humans. So far, only LPAI strains of H5 and H7, rarely H9 subtype have been able to change from LPAI to HPAI. So at the moment, if they are H5 and H7, they consider it as the precautionary lah, okay, that because they can mutate to HPAI. Not all avian influenza virus are zoonotic. However, certain strains of LPAI and HPAI can infect humans. Okay, I think you are familiar with this in your virology. Okay, antigenic shift and antigenic drift. You have heard of this, right, in your virology class? Hopefully. Okay, I ask again in the exam. You should be able to answer this. Okay, the antigenic drift usually a minor change within the same subtype. They have a gradual or point mutation in the gene. May result in epidemic lah. Suddenly there's an increased case or in the population. Okay. However, if happen the major one, which is the antigenic shift, they change into the new subtype, a new type that probably can infect new hosts, have a new ability. Okay, they can spread faster like Omicron, or they can cause much severe damages like Delta. Okay, so they are unexpected what the new change can become. Okay, drastic change by genetic resortment, exchange of gene segment between different host type of species. Okay, may result in pandemics. Okay, this is how the pandemic occurred before. Avian influenza viruses distributed throughout the world. Domestic birds, chicken, turkeys, guinea fowl, chukas, quail, pigeons, geese. Okay, basically all the birds are. Okay, all the birds are possible carrier of the avian influenza virus. Okay, wild avian species such as ducks, geese, and all those things are also great carriers, although they basically are quite resistant towards it. They are become carrier. If they come to chicken, and then the chicken can become infected and cause mortality, but they themselves are sort of like resistance towards the pathogenicity. Okay, avian influenza can be divided into low pathogenic LPAI and high pathogenic, which is a HPAI. LPI is the most common avian influenza type in USA, most common in turkeys where semi-confinement or range rearing exposure to waterfowl. They usually leads to mild respiratory disease, coughing, sneezing, and or nasal secretions, decrease in egg production and quality. There's a lot of multiple strains involved. H5 and H7s are most important, as these can mutate to HPAI. And then when it comes to HPAI, usually affecting the chickens, turkeys, and ducks, H5 and 7 strains are the most important. They can cause much severe disease compared to LPAI, severe depression, high mortality, decrease in egg production and quality, hemorrhages, and edema in tissue. Okay, in Malaysia or worldwide, those infecting with LPAI, basically you don't see much of clinical signs, especially if broilers, you don't see much of clinical signs. If they are layers, then you can see drop in egg production, but not much mortality. Mortality is not really affected for LPAI. HPAI is a different story. They can cause a lot of very severe mortality. Okay, you can expect 100% mortality. You can imagine 100,000 chicken died within 48 hours. They just die. They drop that. They simply drop that. Okay, that is a big warning lah. Okay, if you have a lot of high mortality, very quick, please call DVS immediately because HPI should be suspected. Although velogene ND can also happen. But since most of the chickens are vaccinated against ND, you will not see like 100% mortality against ND. Okay, but if you still have like 100% mortality, all those things, HPI should be your priority, top list of your differentials. Okay. Avian influenza was first described in 1878. They are categorized into highly pathogenic avian influenza and low pathogenic avian influenza. Their characteristic of HPAI, usually they kill more than 75% of 6-week-old susceptible chickens in 10 days. H7 and H5, which do not meet criterion in A, but has an amino acid sequence in the HA cleavage site that is compatible with HPAI. Any AI, avian influenza, that is not H5 or H7, but kills 1 to 5 of 8 inoculated chickens and grow in cell culture without trypsin. The rest are basically LPAI. So this is one of the characteristic of this. Okay, LPI and HPAI. For example, this LPI H9N2 only extracellular trypsin-like serine proteases of respiratory and or all gastrointestinal tracts cleave HA. So they localize in the virus replication and cause low pathogenic, which leads to become a low pathogenic virus. LPI do not contain a series of basic amino acid at the cleavage site. So this is quite advanced to you. I'm not going to put this, but this is a good information. So HPAI have multiple basic amino acid at the cleavage sites and can cause extensive virus replication in a lot of organs. So LPAI, they can replicate maybe in the respiratory, in the GIT, and in the reproductive tract. A little bit of that. HPAI, because of the multiple cleavage sites, they can basically replicate in everywhere, multiple organs. And that's why in HPAI, you'll see basically the chicken are hemorrhagic everywhere. Literally the whole body. Okay. Comparing HPAI, H5N1, LPI infection in poultry seems more widespread and persistent, constituting a greater threat for humans. Okay, which they can mutate later on lah. Okay, go back to here. HPAI cause severe illness or death in chickens, turkey, and guinea fowl. Wild species of birds usually do not develop clinical disease, and only H5 and H7 subtypes has been characterized as HPHI until now and highly pathogenic in poultry. And H5 and 7 could transmit from poultry to humans and cause high mortality in both species. Outbreaks of avian influenza by H5N1 is far more common than H7N1 subtypes. Okay. And then when it comes to clinical signs and lesions, okay, usually in LPAI, okay, what you expect to see are generalized clinical signs, huddling, ruffled feather, listlessness, decreased activity, lethargy. So basically, they just look weak or not, or they look healthy. Mild to severe respiratory signs, coughing, sneezing, rales, rattles, and excessive lacrimation. You may see some of them have mild coughing, like you go to the farm, you see some cough, like chicken can cough, like they sound like, it's not like coughing like human coughing, okay, but you see like rough sound of the rails, like something like that. Okay, and then decrease in egg production if they are egg producing chickens. Okay, in HPAI, what you expect to see are neurologic signs, like tremors, opisthotonus, torticollis, and respiratory signs are the most common: rales, sneezing and coughing, decrease in egg production, and very high mortality. Okay, they're just dying. Okay. Gross lesions for LPI, you can see swelling of the face, okay, fibrinopurulent exudate filled sinuses, okay, in turkeys, this is a turkey, okay, and then you can see asacchalitis, bronchopneumonia, okay, you can asacchalitis, the air sac become thickened and presence of like foamy material inside the air sac and the lung. Okay, some of them have atresia of ovarian follicles. That's why they can cause reduce in egg production and egg yolk peritonitis as well. And in HPI, what you expect to see is, since they cause generalized systemic infection, you will see multifocal necrosis and hemorrhages of the comb and wattles. What you see usually in chickens, they become not just like this, they become like this, okay, bluish discoloration, they become cyanotic. Okay, this is how they look like. Okay, they just become cyanotic. So this is not as bad. You can see some hemorrhages on the wattles, and in some of them, like so bad. You can the whole thing. This is a normal chicken. This is the okay, same as this one. Hemorrhages, and if you open it, there's a generalized edema in the wattles and the comb. And the shank, okay, this is one of the signs that you usually see in HPI case. If you see a lot of chickens have all these cyanotic comb and wattles and hemorrhagic shank, okay, so first thing that you need to do is do not open the chicken, call DVS. Just tell them we have a lot of mortality, and then this is what I observe. A lot of chickens, cyanotic combs and wattles, hemorrhagic shanks. Okay, from the outside lah, from the inside you cannot open yet. Okay, so DVS will come. Okay, they will create a team. Okay, alert, and then they will come with all the PPE, same as COVID PPE, all those things, all full PPE cover and whatnot, to do postmortem and take samples. Okay, and please note, HPAI, okay, is a must report disease. Okay, it's under the law of infectious disease. If you are a vet and you see a case and you did not report because the farmer is nice to you, you want to protect the farmer, nanti farmer tu tak nak jadi klien you apa sama, okay, you can go to jail. Okay, because this is under the law of infectious disease. Again, this is how they look like. Severe subcutaneous hemorrhages of the feet, so basically hemorrhages of the shank. And then if you open the chickens, okay, you'll see generalized hemorrhages. Like for example, particular hemorrhages in epicardial fat, hemorrhages and edema of the lung. This is one of the area that you look for, the proventriculus, hemorrhages of the proventriculus, generalized hemorrhages of the pancreas. Even you see the blood vessel supplying the intestine is also engorged and congested. You can see here. This is also some hemorrhages. Okay, hemorrhages in the lymphoid tissue of Peyer's patches along the intestine. And this one is the I call it cecal tonsil. Okay, this is the common thing that you look for. Okay. Okay, generalized hemorrhages lah, basically. And then the eggs that you see, if they are egg producing animals, the quality of the egg is affected, not just the production. The egg production will reduce, but and also egg quality. They come with shellless eggs, soft shell eggs, or malformed eggs. They become rounded eggs or very long eggs. Like that. Okay, so this is another example of generalized hemorrhages. It's all some bad quality pictures. Okay, so this is a better quality pictures lah. Okay, this is how they look like. And for histopathology, so histopathology usually you don't nothing much that is more pathognomonic lah. Okay, nothing pathognomonic. It's just reflecting back whatever is grossly. Okay, vascular congestion at the lung, necrosis of the pancreas and congestion. diffuse necrosis and depletion of the spleen. Okay, and then for diagnosis, what you have to do is you take samples for molecular and serology. Okay, we have two molecular, we do PCR. You can take sample from the tracheal swab, choanal slit swab, or the cloacal swab. Okay, these are the places that you can take samples from. And serology, we take blood samples. So diagnostic test is you can run QRT-PCR or RT-PCR, real-time PCR or conventional PCR. Serology, you can do HI or ELISA. Since chickens in Malaysia, most of them are not vaccinated yet. Okay, so positive in serology means positive lah. They are infected. Okay, especially broilers. If they are positive, means they are positive for HI, AI. Okay, because they are not vaccinated. This is previously in Malaysia, we do not want to vaccinate chickens in Malaysia because of this thing. Because we previously we declare Malaysia as avian influenza free. We still are, but not HPAI, not to LPAI lah. LPAI is quite everywhere now in Malaysia, but HPAI we still free. Okay. In case of HPAI, it's quite easy to know. It will be on the news. Okay, HPAI is an outbreak of HPAI definitely will be in the news because it must be reported. And for diagnostic technique, you can also do virus isolation, egg inoculation into the allantois and amniotic cavity. I think this one you just revise back your virology notes. Okay, then you should know this. If I give you an empty picture of eggs, for example, in your exam, I just want you to label. I just give you a needle, for example, into the choroid allantois membrane, avian into the amniotic, into the allantoid. I will give you a name of virus can be given. Isolation is through this way, and this way. Can you answer that? Choroid allantoid. Give one example of virus in chicken that can be isolated in choroid allantoid membrane. Give one example of virus in chicken that be given in through amniotic inoculation. Give one example of allantoid. So I just give you an empty picture. They label the virus. Okay. Factors that influence avian influenza. Okay, usually are those farms that are located area with dense population poultry productions. And also, usually in Malaysia, we have 4 outbreak of HPAI. Okay, most of them are all of them happen at the border area. Okay, let me see if I have the notes. Oh yeah, Malaysia is of avian influenza. Before 2004, only LPI subtypes are reported. But in 2004, first case of HPAI was reported in the village chicken in Kelantan. I remember this one. It was a big news back then. 2004, it was big news back then. And then back then, Malaysia are not really good with avian influenza whatnot lah. At that time, they don't have enough people to help. So back then, we sent all DVM5 actually to volunteer to go to Kelantan. Okay, to cull chickens. Okay, and then people in Kelantan or in Malaysia back then are not familiar with AI also, where suddenly people knocking your door, okay, we want to cull your birds. And in Kelantan back then also, they have this habit of keeping a lot of pet birds at the house as well, like ayam serama, burung tekukor. I think burung tekukor is one of the famous one lah. Burung tekukor kan, dia ada bunyi tu. Dove. Ya, burung tekukor lah. Okay, they even have a field in Kota Baru, Kelantan. I'm not sure whether they still have. They panggil padang merbuk or something. Burung merbuk lah kan kalau padang merbuk or something. At the padang there, you can see there's a lot of pole. Okay, like pole, a big, huge, like as big as a football field. Let's on at the field is only a very long pole. Okay, they hang their birds. Okay, it's like a bird competition. Who make the best sound kind of things. I don't know. I've never joined this kind of thing, but it's quite famous in Kelantan. Okay, so what I'm saying is back then it's a big thing lah. Okay, because in our our protocol is within 1 kilometer radius of the point of positive case, all the birds must be culled. It doesn't matter what kind of bird. You ada burung merak ke, burung nuri ke, burung makau ke, harga puluh-puluh ribu ke, all cull. And then you imagine lah, orang Kelantan dulu pun dia suka bela ayam kampung ni, ayam jantan ni, as pets lah. So you simply come to their house. So you imagine lah, for example, Macau can live up to 70 years old, 70 years. Some owners died before the bird died. So imagine going to your house, simply say, we need to kill your birds. Okay, then the birds have lived with the owner for about 20 years or something. Okay, so big mess also. In this kind of case, you always have to bring police together with the vets, because sometimes they just riot. Dia mengamuk, bawa pisau halau keluar. Okay, and in 2006 and 2007, H5N1 reported in Penang, Perak, and Selangor, declared, and then it's quite a big back then, and then declared H5N1 free in September 2007. Okay, we do a lot of eradication process in 2006 and 2007. In 2017, again, it happens in Kelantan, few years back. Okay, this is one small case in Kelantan. I think the first one in Kelantan, if I'm not mistaken, it happened because the owner of this backyard chicken, they went to Thailand. He went to Thailand. He is involved with, you know, this ayam laga, cock fighting. And then he bring back his cock back to Kelantan. Okay, and then he kept his cock together with other birds lah, and infecting other birds. Okay, so he's bringing back the birds from Thailand, the virus from Thailand. In 2018, H5N1 were reported in backyards and commercial flocks in Sabah. This is also in border area of Sabah. Okay, I think somewhere. So this is the 4 outbreaks of H5N1 of HPR in Kelantan. And then after that, 2017 and above, we have a lot of reported case of LPAI, H9N2. There's 5 episodes of detection. This is 5. 3, 4 only. Or is it 2 cases here? Okay. H5N1 virus isolated in 2004 and 2018 have been characterized by sequence analysis. Presently, Malaysia is free from HPAI viruses. Okay. This one is too advanced for you lah, phylogenetic analysis. This one is, we compare our virus with worldwide punya virus. So our virus is similar to Vietnam and Thailand in 2004, and in 2006 is similar to one in China. So we don't know how it comes to Malaysia. So, but this one we can relate it with the one coming from Thailand lah. Okay. The virus transmission, it spreads via the air and manure. It can also be transmitted through fomites, contaminated feed, water, equipment, and clothing. Clinically normal waterfowl and seabirds may introduce the virus into the flock. This is one of the most challenging part. Okay, waterfowl, migrating birds. They can bring the virus into your country, and then they can cross border. Okay, if border of Thailand atau semua tu, kita boleh block kereta-kereta datang masuk ayam apa semua tu. But we cannot block migrating birds. Okay, we cannot block migrating birds. So what we do is sometimes we have a lot of places we put sentinel birds. Birds that are not vaccinated against anything or something dekat border tu, dekat border of our country. And then these birds become, if they get infected, man, we are aware that this virus has come to Malaysia, kind of things. We call it the sentinel birds. Okay. Broken contaminated eggs may infect chicks in incubator. Fecal aurora is the most common method. However, it's not a foodborne pathogen. And then you have to also understand pig as the intermediate host. Are you familiar with this in your virology class? Anybody taught you pig as intermediate host? Hopefully, okay, because pigs are susceptible to all avian influenza A subtypes. They have receptor for avian and mammals. They can act as mixing vessel for reassortment, generation of strain with potential outbreak, and may lead to potential pandemic. I have been to a farm in Tanjung Sepat. The owner of the farm, saya dah cerita ke sebelum ni. The owner of the farm, both are the same owner. Sebelah tu ladang babi, sebelah tu ladang ayam. Lepas dia tengok babi dia pagi-pagi, dia pergi tengok ladang ayam dia pula. Okay, this is quite dangerous. Okay, because the pig can be infected with human viruses, influenza, and then can be infected with bird viruses, even influenza virus. And then if the human and bird, the pig are infected by both of these viruses, okay, and then this virus can exchange their gene. Okay, let's change gene. Okay, change gene, and then they come up with a new virus. A new virus that can infect both human and birds. So that's how they call it the mixing vessel. So it's quite important to not to mix birds, pigs together with birds lah actually. Okay. On abstinently. Okay. This is the HPI diagnosis lah. Usually you suspect when you see severe drop in egg production, high mortality, swollen head, cyanotic combs and waters, hemorrhages in general tissue. Clinically is quite indistinguishable from virogenic Newcastle disease. So when you send sample, you have to also test for Newcastle disease because their clinical sign is very similar with virogenic Newcastle disease. So you just want to know whether it's okay. This is just the same one as just now lah. Okay, how to diagnose avian influenza. Okay, for the control, biosecurity is important to prevent exposure by preventing contact with wild birds and other birds. Serologic surveillance, detection of antibody using AGID or ELISA. Vaccines not commonly used, as exception is H1N1 vaccines for turkey breeder hens. But it's not in Malaysia also lah. Okay, this is not in Malaysia, in US. Eradication, euthanasia, carcass disposal, cleaning and disinfection of HPAI. Okay, in Malaysia, we still do eradication as our methods of, and it's a reportable disease. Let me see. Wait, this one. Okay. So general, okay, AI prevention. Except that in Malaysia now, we allow vaccination. Let me see. I will put in the notes lah. But in general, that's how we do. Sorry. Okay, in Malaysia, we allow vaccination only for LPAI, H9N2. Okay, but through limited use, we call it emergency use as well. The farm that need to use the vaccine, they have to declare that they have virus. They have been infected with H9N2 and it can cause loss in production. Then only in the next subsequent batch, the DVS will allow the license for H9N2 vaccination. Okay, so it's only limited use, only certain farms only. In basically, and not for broilers, only in layer and breeders only. Okay, broiler are not allowed to vaccination yet. Okay, and for HPAI, no vaccination yet. We don't allow vaccination yet. There's some lot of limitation of vaccine and vaccination lah. It's quite expensive. Kill vaccine, there are only kill vaccine is allowed. So individual handling and poor local immunity. Immunity develops a bit slow 3 weeks after the first vaccination, and it requires at least 2 doses. Okay. Only vaccine antigen HA with the highest mesh provide robust protection. Hence, AI vaccine seed virus must be updated every 2 to 3 years. So you need to know what is the current strain that you have in your country, and then you have to find the best match vaccine that are very similar strain with the virus to have the best protection. Okay. One of the limitation is it's possible that the vaccine itself can exchange gene with the field strain. Okay, we call reassortment of the virus or something can cause another outbreak. Okay, a new virus, evolution of a new virus. Okay, it's difficult to eradicate the disease. High chance the disease will become endemic in the future. Okay, for H9N2. Okay, H9N2, personally, I've seen a lot of cases in broilers as well. But broiler, they don't care so much. It doesn't cause so much problem unless the chicken are infected with several diseases at the same time. AI by itself, if they get infected, the chickens don't show any clinical signs. But if the chicken are also infected with ND or with IB, they amplify the ND virus. The ND becomes so much worse. The IB becomes so much worse. So that's one of the things. This one. There's some advantages of the vaccination. It increases the threshold for infection. So you need more infection to more doses to cause disease and infection. Reduction in virus shedding. We have shown that vaccination can reduce the spread of the virus. Okay, it prevents the replication of the virus, and it reduces occupational hazard faced by poultry workers and other people in contact with poultry, because if the virus cannot shed to human, and then the virus cannot infect humans. Reduce viral replication in poultry population is reduce the likelihood of mutations and reduce the risk of transmission to other species as well. These are the advantages of vaccination. Okay. This one I'm not going to go through lah. It's quite long. Okay. So this one. Okay, I want to zoning in Malaysia for avian influenza. How we do the eradication in avian influenza. Okay. In 1 kilometer radius, we call it the infected zone, stamping out. Okay. Within 1 kilometer radius here, all the birds, any birds have to be culled within 1 kilometer radius. Okay. And then after that, surveillance zone outside of it around 10 kilometer radius. Okay. From here, we do a random sampling, all the sampling of the birds around the 10 kilometer radius. And then if you have another case of positive around here, and then your circle start here, 1 kilometer from here must be culled. Okay, 1 kilometer from here must be culled. And then you screen another 10 kilometer from the new point. And then the point keep enlarge until there is no infection anymore. Okay, you detect no infection anymore. So that's how it works. Okay. HPI control and eradication policy. This one you can read. Okay, this is the same one that I mentioned just now lah. So we stamping out and disinfection. Case definition is detection of HPAI virus subtype H5 or H7 in domesticated chicken, ducks, and birds. We confirm through PCR at the VRI, Ipoh. Compensation. Do we compensate the owner for culling all the birds? Commensurate and timely compensation. Okay, depends on if the government have money at that time also. Okay, kalau dia bergantung pada state juga tau. Kalau state ada duit, dia boleh compensate. Kadang-kadang tak ada duit, tak adalah. Okay, infected premise that confirm HPAI. Protected or zone control. 1 kilometer radius around the infected premise. They call stamping out zone. We cull everything. Surveillance zone is 9 kilometer radius from the control zone. And free zone is other areas. Surveillance strategy, we do intensive clinical and virology within 42 days. Okay, we surveillance all these birds within this one for 42 days. Okay, why 42 days? Because those are chickens that have incubation period or something, if I'm not mistaken. Okay. And then free zone. Okay, this surveillance zone. For free zone, active or targeted, we just choose randomly out in the free zone for clinical for testing lah. Okay, outside here we can also test. Outside here, the white area here, we also test sometimes, but we targeted certain big farmers or something. Okay, freedom declaration is 3 months after first infection. So the farm have to be free for 3 months. Then only they can have a new batch of birds. And vaccination is prohibited for HPAI. Okay, I think basically that's all. This is the one that I want to remove lah. In your notes. This is the example of epidemic in the world. Scotland, this is all the previous epidemic in the world. This one, bird flu in Hong Kong, 1997. Human died. 6 or 7, 8 human died, no human or human transmission, slaughter of all poultry and about vaccination program. This is the bird flu outbreak in 2004 when it happened in Malaysia as well. It has spread to 10 countries in Asia with 23 human deaths. More than 1 billion chicken have died or been killed due to the current bird flu crisis in Asia. Back then, Asia is under the crisis of avian influenza outbreak. Okay, Indonesia are badly affected back then. Okay, in 2004. This is some statistics. I can upload this one also if you want to read, but it's not important for you to understand. Okay, this some example some information on bird flu in humans. In children can cause high fever, bluish skin color, not changes in mental status, flu-like symptom, and then death. In human as well, it's similar to COVID lah. Actually, it's very similar to COVID also. Okay, this is how they do. This was in the news before lah. Okay. Chicken disposal. We have to cull all the birds. How do we cull birds? Any idea? Ke ada cerita kat you? Okay, for birds, if it's open house, closed house system is quite easy. You just turn off the ventilator. The birds will suffocate within few hours. Kejap je mati sebab the ammonia build up and then CO2 build up by themselves. Okay, if open house system, we either cervical dislocation pun ada. Kadang-kadang apa tu? Kita cull manual dislocation boleh tapi sakit lah tangannya. Okay, what they do is they use CO2. Masuk dalam guni, lepas tu masuk CO2. Lepas tu dia mati. Masuk dalam guni, masuk CO2. Lepas tu mati. Okay. Lepas tu kita bakar. Atau selalunya kita gali lubang banyak-banyak. We dig a hole, big hole. Dump everything into the hole. Burn the chicken inside there. And then kambus. And then you put lime around it. Kau pernah tengok pig punya tak? Pig lagi lah. Kalau pig dulu waktu Nipah virus, they herd all the pig into a big hole. And then they tembak with machine gun. The pig will all dead. Okay, and then bakar and then kambus. So this one is the vaccine concern. This thing. Banyak lah. Sebab tu saya tak nak masuk semua benda. Nanti korang baca. It's good lah untuk baca. Tapi baca banyak sangat nanti korang hafal. Nanti lepas tu tak hafal benda yang important. Okay, I think that's all for today. It's quite straightforward. Okay, any question on avian influenza? It's very important disease. It's a very, very important disease. We don't have so much in Malaysia except LPAI, but it's a very big topic in the last few years, the LPAI, because it caused some company went bankrupt because of the LPAI. They affected the breeder farm. They have to cull all the breeder farm because all the breeder farm did not produce eggs properly. Oh, ada chat lah, saya tak perasan. Oh, tak ada. Okay. Any question? Any question or anything? The previous lecture or this lecture? HPAI, LPAI? Anything? If there is no question, just wait for my question in the exam. Okay, guys. That's all for today. Selamat berpuasa lagi. Okay. Have a good day and week ahead. Thank you, guys. See you.
Okay, doktor. Okay, doktor.
Doktor.
Saya lupa record lah lecture ini. Tak apalah. Korang ambil nota kan? Okay, guys. See you guys. Nanti saya upload the notes, updated notes lah. Because